Much anticipated reforms to the aged care system will come into effect today. The new Aged Care Act introduces a suite of new measures, including a professional code of conduct, and aims to improve quality standards, but also changes the way Australians pay for residential and out-of-home care. The new co-payment schemes mean some older Australians will pay much more for essential care. The changes will also impact nursing homes and end-of-life care. Aged Care Minister Sam Rae says ensuring the community has been well informed about the changes has been a key driver in ensuring the transition is as successful as possible.
These are complex changes. It's a complex system. I acknowledge that. Part of this process has been trying to reduce some of that complexity. And I think as human beings, whenever we are undergoing significant change in our lives, there is always an element of anxiety. Communication has been a critical component of this process. The aged care changes were announced in September 2024, and the legislation was moved through the last term of Parliament. In recent times, we've sent out more than 600,000 personalised letters to older people all across the country to help them to understand what these changes mean for them personally. We've also held more than 50 public forums in every state and territory. We've had more than 500,000 visits to the website. So there is an element or a strong element of people's awareness here. We're working with providers in the sector to make sure that everybody understands, older people themselves, their families, their support networks, understand what these changes mean for them.
Val Fell is a member of the Aged Care Council of Elders and has been an advocate for aged care for several decades. She says there's anxiety surrounding how the changes will impact them.
This new act is a mixed bag. There are positive things and there are negative things. And many people have complained to me at meetings that the thing that worries them most are the waiting times for assessment. The waiting times then go on to waiting to, once you're assessed and you get your package, you then have to wait again to have the actual money assigned to you. And then there's the problem of finding providers, etc., etc. Now, that is going to hopefully change over the next few years, or particularly between now and 27, because, excuse me, there's been an increase in the number of packages going out. They're going out at a rate, by the time we get to the middle of next year, 83,000 of the extra packages which were allocated previously will be in place, and that will, sort of slow down the delivery of services. But as I said, there are a lot of positive and negatives, and the waiting times was one. And the other thing is that people were aware of a lot of the changes, but not the fine details. And the fine details have recently been released. So there's a lot of anxiety about what it is actually going to do for them. Most of the people, as Sam has said, will have received letters which tell them that. But then the prices of some of the services they were receiving already have been increased. So it may be a case of people under the no worse off principle getting the same amount of funding, but not necessarily the same number of services because of the increasing costs.